Here with us is Thijs Janssen. Thijs is a very experienced respiratory therapist with whom I've worked over a number of years, taking care of a variety of patients with respiratory illnesses. Thijs has a lot of experience, I believe, in using high-flow nasal cannula therapy.
Oh, yeah.
And I'd be interested in hearing your thoughts, Thijs, about the role of high-flow nasal cannula in today's world.
Well, I kind of look at it as something that stands between mechanical ventilation or positive pressure ventilation and low flow therapy. So you have most patients, I would say, do okay on just a little bit of low flow oxygen, but then it comes to a threshold where high flow therapy really comes into play, because what we're really trying to do is to avoid, as you know, the complications from being on mechanical or positive pressure ventilation, whether it's invasive or non-invasive, can be profound, whether it's the skin issues from the non-invasive or all of the complications of intubation. This high flow kind of stands in between and becomes a modality that I feel is increasingly used to try to avoid using some of these higher risk modalities.
Yeah, that's a question I had. I wonder whether you feel like in the last decade we've seen a rapidly increasing use of high flow, or are we resorting more to non-invasive ventilation?
I really do feel like it's increasing, and I was actually going to ask you the same question if there's something in the data. From my perspective, I feel like the role of the respiratory care practitioner has really advanced from when I first started. A lot of what we did as a respiratory care practitioner was physician ordered explicitly right on the spot, whereas I feel like our role now has molded into really critically thinking about how do we move towards the goal with this patient, to perhaps prevent having the patient be intubated or on non-invasive. And this tool sits right in the quiver for us, ready to intervene and prevent that critical step. So I really feel like this high flow therapy has empowered the respiratory therapist, so to speak, in preventing positive pressure ventilation when not necessary.
So for you as a respiratory therapist, how important is rapidity and ease of setup for a high flow device?
It's everything, really. I think the quick turnaround of being able to take a unit that's sitting in the dirty utility room that has been used on another patient, to be able to take a kit and turn that around as the respiratory therapist, that's great. That's something that I haven't seen in the product that we're currently using, at least, and I feel like that's very important.
So Thijs, are there some applications for high flow nasal therapy that you're seeing in use now that maybe we didn't use so much in the past?
Yes, definitely. The use is up for high flow therapy in general, and one of the things that we noticed was a lot of the surgeons were ordering it for their surgical patients, as well as the trauma doctors were ordering it also. And the purpose for this is there's some data that shows that the use of high flow nasal cannula is actually helping prevent pulmonary complications post cardiothoracic surgery, as well as, say, in trauma. If a patient has rib fractures and they're not taking deep breaths, the high flow nasal cannula therapy is actually proven to reduce pulmonary complications for that. So we've actually developed a protocol at our hospital by which the respiratory therapist is empowered to, when they see this scenario, go ahead and apply the high flow therapy to the patient for that purpose. So that's very exciting for the respiratory field. In addition, the high flow therapy will be used perhaps to hyperoxygenate a patient before a procedure, or particularly before intubation, and such. As these patients come to SICU and are extubated, sometimes they're put directly on high flow, and the idea there is to prevent or decrease the likelihood of having to reintubate. So there will be a period of high flow use post-extubation, just to bridge that gap and get the patient moving in the right direction, and then they'll be subsequently weaned to low flow oxygen. So, yeah, a lot of new uses.
I think all of those sound like really good use for high flow nasal therapy. In the COVID pandemic that we're currently in, I've been using high flow nasal cannula a lot more for pre-oxygenation of patients who do need to be intubated as an alternative to bag valve mask ventilation, which is an aerosol generating procedure and really is a no-no in the current environment.
Right, interesting. You mentioned COVID. With all these patients in isolation, one interesting feature of the HFT 150 that I'm very excited about is the integration with the nurse call alarm system. I think that this is a unique feature that's going to really be a benefit to have the alarms be heard out at the nurse's station when a patient is in these isolation rooms is going to be great. And as you were talking, I also remembered one aspect with these surgeons that are now ordering this modality is they really need their patients up and out of bed. If there's one thing that's going to help them, it's early mobility, and the HFT 150 with the optional rolling stand and the integrated battery and just how everything's integrated. There's no extra wires. Any wires are integrated into the tubing. It's just so streamlined for the nurse to be able to just pop their patient out of bed and get mobile. Really, there's no excuse for PT or nursing to not be able to get their patient up and moving. And I really feel like the physicians like the high flow therapy instead of perhaps other modalities. They might prefer that just for that reason alone, that their patients are more likely to get moving, which is key. Yeah.
I think the point about the nurse call feature is really on point in this time when we're at greater distance in some cases from our patients who are in isolation. Gives us an element of security that we really need.
Yes, definitely.